experts say colon cancer has been on the rise in people under 50. And with no single known cause, local healthcare providers are urging people to get screened. Joining us live is surgical oncologist for Dignity Health Community Hospital, San Bernardino, Dr. Amir Azar. Thank you so much for being with us.
Thanks for having me.
Well, what are some of the key contributions that could lead to colorectal cancer?
Colorectal cancer has been known to our communities for a long time. It is the second leading cause of the deaths in the United States. There are multiple risk factors are known to be associated with the colon cancer: genetic disease, familial disease, our diet, including consumption of the red meat and processed meat, alcohol consumption, loss and lack of the physical activities. All those are risk factors that are known to increase the risk of the colorectal cancer in the community.
And what are some of the symptoms that people might notice that might give a sign that you might have that?
That's an excellent question. In some cases, it is just silent disease, and we need to just be aware of it and screen for it, that we can talk about it. But the symptoms that everybody should be aware of is any change in the bowel habits, any unexplained weight loss, any changes or any blood in the stool, or when you're doing the blood work, you will find out that your red blood cell, or what we call anemia, is happening. All these are symptoms that should urge us to go and seek the expert's opinion and find out that what is happening.
I think it's shocking that even younger people are starting to be diagnosed with it, like we talked about. Are there some risk factors that could make people more susceptible to it?
What is really staggering, as you mentioned, is that younger and younger people are being affected by disease. And even worse is that we are seeing the people are coming with the later stages of their disease. The total pathologic etiology of this cancer in the younger age is still unknown. But again, it goes back to the familial disease as well as the risk factors that we are dealing with more and more every day in our community.
Okay, with that being said, when should people get tested, and then how often?
When we are hearing all this bad news, it doesn't mean that there's not any hope. Thanks to our advances in the molecular genetic studies, there are ways that we know and we can study the disease better. There are new treatments, and also with new advances in the technology, we can operate on the patients as long as there are early stages. However, the key factor is, and it's the most important one, is that people start screening for the colorectal cancer at the very early age of the 45. And this is just for people who are in the average risk. Obviously, people who have a higher risk, they need to start it early. And the key factor, again, is just getting the colonoscopy or any other modalities that are very, very available in our community and get it tested.
Such an important topic, and definitely good to have awareness, especially as it gets younger and younger as far as those who are being diagnosed with it. Where can people go for more information if they'd like?
There are many websites that people can go for it. There's a CDC website, there's an NCCM website, and all the local communities, the primary care doctors that can provide information about the colorectal cancer and how they can be screened.
Okay, Dr. Amir Azar, thank you so much for joining us, and thanks for all that information.
Thanks for having me.
All right.